I'm checking in with you today on a prep for a visit to the dentist this afternoon. Now, I'm usually not too skittish about dentist stuff, and it's fine, but I'm getting some gum work done. I've had this done before, so I'm finding myself as I'm thinking about my day and planning things, I'm noticing I'm a little anxious about what's to come. It may be that it's I'm being triggered from the last time I went, but anyway, I when you become aware, if you got something going on in the day and you become aware that there is a little anxiety. See, I can feel it even. I don't need to muscle test this. And I'm going to start by, because I've been through this procedure before, I'm going to start by uh, tapping for trauma. So I'm just going to do this. I'm going to correct for reversal, tap under my nose. The trauma tapping is beginning of eyebrow, under eye, underarm, under collarbone. Yeah, I feel something shifting right there. I didn't give you the sud level. I'm just trying to get this done. One, two, three, four. Yeah, sud level might have been 4 or 5, but I'm already feeling it shifting. Uh, Underarm, under collarbone. Yeah, that feels better. So whatever is being triggered from the past seems to have calmed down. What I'm going to do now is now am I a little anxious about what's coming, having nothing to do with the past? Yeah, one or two. Well, that would just be tapping, and I'm going to correct for reversals under nose, and just tap for anxiety under eye, under arm, under collarbone. Gamut series, back the other way. Hum. Count 1, 2, 3. Hum again. Um, yeah, most of the time I go to the dentist, and I hope for most of you, going to the dentist is not a big problem. And but if it is, you don't need to suffer with it. You tap from the trauma of the past stuff. You tap about any anxiety coming up. I've done a lot of work with dental assistants and people who have dental phobias, and this stuff is very effective. I'm going to show you one other thing that I find is useful when I'm going to the dentist, which is I preemptively tap for pain. So I'm just going to think about the fact that there'll be a little this and that. I don't want to trigger anybody, but I know that I'll feel it for moments. Now, I'm usually pretty not squeamish about pain or anything, but the less of it I feel, the better by me. So what I'm going to do is I'm just going to think about what's possible in terms of what might be causing some discomfort either before, during, or after the procedure. And then I'm going to just tap for pain. So I'm going to correct for reversals. And then I'm going to tap for pain using the algorithm, which is gamut 50. And it's gamut 50 collarbone. So I'm going to go through this. It takes a little longer than usual. Now, I don't really have a sud about this. It's just I'm kind of getting my mind and body and energy systems aware that we don't need to experience the pain. We really don't. And then collarbone, I'm going to do the 9 gamut series. World eyes around, back the other way. 1, 2, 3. And then I'm just going to keep tapping at the gamut spot. Now, if you do go to the dentist and then later you have a little discomfort or pain with it, you can certainly do this algorithm to see if that helps. I find that every little thing you can do before you go is going to make it better after you come home. So, and then it's under collarbone. Okay. So now that I've got that kind of awareness that that was going on, I've got that out of the way. I can get on with making my list for today and getting some other things done. I hope that you might find this useful if you have a dental visit coming up. Or if you've got any dental trauma, please tap for it. You don't need to be afraid to let the healthcare professionals take care of you. And if you have any questions, just reach out, rlbray at rlbray.com. And I will see you again soon. Bye-bye.